Doctor, you were telling us about a fracture of the femur? That is correct. That your patient suffered? That is correct. What is the difference between coxa vara and coxa valga? Well, coxa valga is a widening of the angle between the shaft and neck of the femur. Coxa vara is a diminishing of the angle between the shaft and neck of the femur. Does that result, doctor, in a deformity of the bone? Well, it results in a congenital or acquired abnormality of the bone, which results in disfigurement. And epiphysitis is what? Epiphysitis, acute, is an inflammatory process of the epiphyseal region of a long bone. What is it marked by, doctor? It is marked by tenderness and pain of the joint. And what is epiphysiolysis? Epiphysiolysis is a slipped epiphysis. Is that a loosening or separation of the epiphysis, doctor? From the shaft, usually a slipping of the upper femoral epiphysis. Now, doctor, there is eversion of the limb resulting in displacement and limping. That is correct. And that is epulis? Well, epulis is a fibrous tumor arising from the gum. And what is Ewing's sarcoma? Ewing's sarcoma is a malignant new growth originating in the shaft of long bones and spreading through the periosteum into the soft tissues. So you are saying, doctor, that metastasis occurs? Yes, there may be several metastases that occur early. The femur, doctor, the tibia, the humerus, the fibula, the pelvic bones are frequently involved, are they not? Yes, they are. And there may be bone tumor? Well, what we call exostosis. It is a bone tumor or osteoma, a benign osseous growth. Doctor, what is fibrous dysplasia of the bone? That is Albright's syndrome, a metabolic bone disease characterized by rapid resorption of the bone. And doctor, can it be that there is a fibrous replacement of the marrow? Yes, a fibrous replacement of the marrow, correct, as well as a distortion of one or several bones, and brownish pigmentation of the skin and precocious puberty in girls. Doctor, what is your definition of a fracture? A fracture is a broken bone. Long bone fractures are frequently associated with nerve history. And non-penetrating or closed fractures are what? They have no external wound present. Can there be a penetrating or open fracture in that case? Yes, an external wound communicating with the fracture. May the fractures be capillary? Well, if they are hair-like along the line of break. And comminuted? Comminuted simply means a bone splintered into small fragments. How about a complicated fracture? A complicated fracture is a broken bone injuring adjacent structures, for example, a fractured rib piercing the lung. What is a compound fracture, doctor? A compound fracture is an open wound leading down to the fracture. And a depressed fracture? A depressed fracture is a broken bone inwards, as in certain skull fractures. And a green stick fracture? A green stick fracture is an incomplete break, which may be associated with bowing of the shaft. Is that different from an impacted fracture? It is different. It is a broken fragment wedged into other bony fragments. What is a pathological fracture, doctor? That is a spontaneous fracture due to bone destruction in certain disease, such as cancer, syphilis, osteomalacia, osteoporosis, others. Doctor, a simple fracture is what? A simple fracture is an uncomplicated fracture with no open wound. Finally, doctor, a transverse fracture is what? It is a break across the bone. For example, Colles fracture, which is a transverse fracture of the radius above the wrist with displacement of the hand. Doctor, fractures of the hip are different from those of the arm? Of course. A break in the upper end of the femur is a break of the hip. The two main types are femoral neck fracture, which is a bone broken through the neck of the femur, and the trochanteric fracture, which is a bone broken below, around, or between the greater or lesser trochanters.
A little tough there.
Okay.